Dengue fever is a mosquito-borne tropical disease caused by the dengue virus. Symptoms typically begin 3 to 14 days after infection. These may include a high fever, headache, vomiting, muscle and joint pains, and a characteristic skin rash. Recovery generally takes 2 to 7 days. In a small proportion of cases, the disease develops into a more severe dengue hemorrhagic fever, resulting in bleeding, low levels of blood platelets and blood plasma leakage, or into dengue shock syndrome, where dangerously low blood pressure occurs. Dengue is spread by several species of female mosquitoes of the Aedes genus, principally Aedes aegypti. The virus has 5 serotypes. Infection with one type usually gives lifelong immunity to that type, but only short-term immunity to the others. Subsequent infection with a different type increases the risk of severe complications. A number of tests are available to confirm the diagnosis, including detecting antibodies to the virus or its RNA. A vaccine for dengue fever has been approved and is commercially available in a number of countries. As of 2018, the vaccine is only recommended in individuals who have been previously infected, or in populations with a high rate of prior infection by age 9. Other methods of prevention include reducing mosquito habitat and limiting exposure to bites. This may be done by getting rid of or covering standing water and wearing clothing that covers much of the body. Treatment of acute dengue is supportive and includes giving fluid either by mouth or intravenously for mild or moderate disease. For more severe cases, blood transfusion may be required. About 500,000 people require hospital admission every year. Paracetamol is recommended instead of non-steroidal anti-inflammatory drugs for fever reduction and pain relief in dengue due to an increased risk of bleeding from NSAID use. Dengue has become a global problem since the Second World War and is common in more than 120 countries, mainly in Southeast Asia, South Asia and South America. About 390 million people are infected a year and approximately 40,000 die. In 2019, a significant increase in the number of cases was seen. The earliest descriptions of an outbreak date from 1779. Its viral cause and spread were understood by the early 20th century. Apart from eliminating the mosquitoes, work is ongoing for medication targeted directly at the virus. It is classified as a neglected tropical disease. Typically, people infected with dengue virus are asymptomatic, ranges from 3 to 14 days. But most often it is 4 to 7 days. Therefore, travelers returning from endemic areas are unlikely to have dengue fever if symptoms start more than 14 days after arriving home. Children often experience symptoms similar to those of the common cold and gastroenteritis and have a greater risk of severe complications. Though initial symptoms are generally mild but include high fever, the characteristic symptoms of dengue are sudden onset fever, headache, muscle and joint pains, and a rash. An alternative name for dengue, breakbone fever, comes from the associated muscle and joint pains. The course of infection is divided into 3 phases: febrile, critical, and recovery. The febrile phase involves high fever, potentially over 40 degrees Celsius can appear at this point, as may some mild bleeding from the mucous membranes of the mouth and nose. The fever itself is classically biphasic or saddleback in nature, breaking and then returning for 1 or 2 days. In some people, the disease proceeds to a critical phase as fever resolves. During this period, there is leakage of plasma from the blood vessels, typically lasting 1 to 2 days. This may result in fluid accumulation in the chest and abdominal cavity as well as depletion of fluid from the circulation and decreased blood supply to vital organs. There may also be organ dysfunction and severe bleeding, typically from the gastrointestinal tract. Shock are at an increased risk. This critical phase, while rare, occurs relatively more commonly in children and young adults. The recovery phase occurs next, with resorption of the leaked fluid into the bloodstream. This usually lasts 2 to 3 days. The improvement is often striking, and can be accompanied with severe itching and a slow heart rate. Another rash may occur with either a maculopapular or a vasculitic appearance, which is followed by peeling of the skin. During this stage, a fluid overload state may occur. If it affects the brain, it may cause a reduced level of consciousness or seizures. A feeling of fatigue may last for weeks in adults. Dengue can occasionally affect several other body systems, either in isolation or along with the classic dengue symptoms. A decreased level of consciousness occurs in 0.5 to 6% of severe cases, which is attributable either to inflammation of the brain by the virus or indirectly as a result of impairment of vital organs. For example, the liver. Other neurological disorder,